Be Heard project is a consumer initiative. It came out of the Consumer Advisory Committee, and it was designed to promote safe and effective communication at the hospital for our patients.
One of the big parts of the campaign is actually awareness within staff of the hospital. Awareness about the prevalence of hearing loss. We know that 1 in 6 people have a hearing impairment in Australia, and we know that those rates are actually higher within the health system.
Well, I was first identified as being deaf when I was just 4 years old. I had the first cochlear implant in 1987, but it didn't work. And so I followed a series of operations up to 1990. Then I had another one a few years later, which made me bilateral. And I hear very successfully with 2 cochlear implants.
Lost my hearing at the end of the Second World War, and I was 7 at the time. We didn't have that technology then. There's very little of it. Technology, of course, over the years has made great strides. I currently wear a cochlear implant, and previously I wore hearing aids. But despite the technology, I've still had to battle on to try and understand what people are saying.
I belong to a number of organisations who support deaf and hearing impaired people. I think it occurs in situations such as when you're in hospital or in that sort of environment, when you know it's important that you hear and understand. It can make a total difference if people get my attention, face me, speak clearly, not too quickly. Good communication is a part of creating a safe environment.
For people to make informed choices about their own health care, they really need to be able to communicate effectively with providers of their primary health.
It's about making sure that the hospital is doing everything that it can to support people who are deaf and hard of hearing.
Even in rehab, I have a few tools to help me with my position here. Headphones, and I also have signs for the public to come in so that they know I'm hard of hearing.
Our speech has become much more rapid, and it's become much more difficult for people with hearing loss to understand what they're hearing.
If a person's speech is nice and clear, I won't have any problem hearing them and lip reading them.
It makes the difference between whether I hear and understand and feel comfortable, or whether I don't and miss out entirely.